The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, this is a brand new topic for us. You know, we've used the term minimally invasive facial rejuvenation today, but we're talking about these low downtime facelifts. Are they for you? Who's a candidate? And what are the new techniques and breakthroughs? But with us, we probably have the newest, in fact, as of today's date, the newest board-certified plastic surgeon in the desert, Dr. Habash. Dr. Habash, welcome to the program.
Thanks, Randy. Thanks for having me on.
All right, we should start with, now you work with the other board-certified plastic surgeon, Dr. Mo Zachary, who we've had on the show for many years, good friend of mine. What is your role there at the center?
I'm also a board-certified plastic surgeon, so I do all the traditional cosmetic procedures that you associate with plastic surgery.
Like?
Breast augmentation, tummy tuck, facelifts, eyelid surgery, facial resurfacing with lasers. I also bring in a component of trauma and reconstruction that I do through the hospital, so it adds a little bit more diversity of our patients that come through the office now.
So moving on to this max lift, I'm calling it a low downtime facelift. What do you call it?
Well, I look at it as more of a modification of a traditional facelift. We do all the things we do with a traditional facelift, but because of our increased knowledge of the face and how the face ages, we're able to do this under local anesthesia with sedation. Most people are able to be recovered, in 5 to 7 days, minimal swelling, minimal bruising. So, I don't necessarily like the term low downtime.
Okay, but it's more minimally invasive.
Minimally invasive is probably the best approach to it. And the reason it's
But what about the results? I mean, are there results there?
Yeah, and the reason it's minimally invasive is because we understand more about how the face ages, so we don't have to address a lot of the things that we were addressing before. So we just restore somebody to a more natural, youthful position, but without doing the extensive work that we had to do before. And a lot of that stems from our improved surgical techniques, as well as our improved knowledge of facial aging.
Is it exciting for you, by the way? I mean, because you've joined, I'm sure, the biggest and the hottest center in the desert. In fact, we're in San Diego right now.
Yeah.
And I've been in centers in LA. I mean, you probably have one of the biggest centers. For people that don't know who you are, you guys have the biggest surgery center. You got 2 huge ORs.
Yeah.
Probably the biggest place in the desert.
All the equipment is up to date, brand new, certified operating room, very large facility, but we also have 2 surgeons, estheticians, skincare, laser treatments. We really have an all-encompassing aspect of our center. Well, the benefit of having 2 surgeons, both of us being board-certified plastic surgeons, is that we stay up to date on the recent techniques. We're able to learn from one another. I do a max lift, and Mo does more of a traditional facelift. So whatever type of patient comes through the door, we have really the best of both worlds to be able to offer these patients.
Okay, this max lift. Okay, so what are you addressing in a max lift? What defines it?
The max lift really focuses on the lower facial aging. It addresses the jowls and the neckline. It does address a little bit of sort of the volume that we lose within our cheeks as we age.
Now, what are the age ranges of the patients getting this lift?
I don't really look at an age range as much as the extent of facial aging. And the people that have more mild to moderate evidence of facial aging are the ideal candidates.
So like what? So when your jowls are starting to sag?
Yeah, absolutely.
And the neck, what? You're looking for banding? Or what?
Banding, muscle laxity, skin laxity. The biggest thing that most people come in is they tell me that, one, they want to look like they feel. Most people feel younger than they appear. And the other thing that a lot of people notice is they'll see a picture over Christmas and they'll see the side profile and suddenly they are unhappy with what they see. And when people come in with those complaints, and those are usually, the beginning stages of facial aging, that's when we can really make the most advancement within these people.
So are people doing this max lift in their 40s? 45, 50, and can they be in their 70s?
Absolutely. People come in their late 40s and start to have early evidence of facial aging and want something addressed, and this really allows us to do that in a very natural way. People that in their 70s that have taken care of themselves, and even people with more advanced facial aging, will come in and they're candidates for the max lift. I think the big benefit that they like is the local anesthesia, the sedation, no general anesthesia, decreased operating room times, and overall that makes it a little bit more of a safer procedure. What I like about it is it gives us a natural, long-lasting
natural
result.
Look. And now I heard, by the way, and I don't know who it is, but even a plastic surgeon has gone to you for a max lift.
Yeah, and I think
that's got to feel good, right?
Well, it does, and I think people want a natural look. People, men and women, don't want to look like they've had work done. They want to look youthful. They want to look natural. And when a colleague comes to me and wants something, yeah, that is a great compliment to me, and I appreciate that greatly. I think that the key thing to look at is when somebody comes in, their concerns are very unique to them. And the evidence of facial aging.
What do they say, by the way? Okay, so on a consult, max lift, they don't want the traditional facelift. And maybe, thermage isn't working, all the radio frequencies not working, it's not tightening, it's not pulling up those gels. What do they say on the consult?
Most people will come in and really specifically point out one or two areas, whether it be the jowls, the neckline, and they just feel that area of the face is aged disproportionately to the rest of the face.
How much does it bother them, by the way? I mean, what do they say to you?
It's enough that they've come in to see me,
Okay.
And so that's usually a very big step for patients. And I tell people the same thing. Nobody needs plastic surgery. Nobody needs a cosmetic surgeon. But if there's something that bothers you enough that you're looking at yourself in the mirror and you coming in to see me, then we can talk about the safe.
Do you think it holds people back?
I think
that means, if something bothers you about your appearance,
absolutely
holds you back.
Absolutely.
I
think
okay.
the extent of body self-image and how it sort of comes across in daily interactions is rather significant. And we see that with breast cancer patients all the time. Women that have had mastectomy, it really limits their social interactions, what they're able to do, not only personally but professionally. And then just going through a reconstructive procedure or a cosmetic procedure really returns them to either a more youthful appearance of themselves or a more earlier state of themselves where they're happier with their body or their face. And they suddenly become more interactive and more outgoing. And, and I don't attribute it to solely cosmetic surgery. It just improves their overall self-image.
What about in an economy like this? What is your case for doing something about the aging face?
Well, there's a couple things. People are forced to work later in life than they weren't before. There was actually a study that looked at people, and the more youthful person gets hired more readily, makes more money, and I don't agree with that, but unfortunately that's sort of
that is
society.
True. Interesting.
One of my patients is a flight attendant, and she came in and she's 6 years old, and because of the economy she felt like she needed to continue to work for another 5 or 7 years, and she felt like her younger competition was really pushing her out, and she came in solely because she felt youthful but just didn't feel that her face matched her overall energy levels. So she went through a max lift, loved the results. Really,
How much younger can they look? Okay, you take a 60-year-old. What are they saying?
Well, my patients usually say that they look 7 or 10 years younger, and that's usually more their husbands making that statement more than the patient.
All right.
And I think the key thing to look at here is that we are going to restore them to a more youthful them. We're not going to create something that wasn't once there. We're going to naturally enhance what they already have.
So you're not pulling, you're kind of, and this is from you on the phone, you're repositioning?
Repositioning. Years ago we would just tighten. And some people looked okay with that, but a lot of people had that wind-blown appearance to the face. And that's something that scares a lot of people. They don't want that surgery appearance to the face.
They don't want a done look.
Exactly. And so what we do now, because of our increased knowledge of how the face ages, we are re-elevating the fat and the muscle to a more youthful position, giving the patient a more rounded appearance to the face.
Why is it called a max lift? Is that just marketing, or does it stand for something?
Max lift is an acronym, MACS. And MA stands for minimal access. So we've changed where we place our incisions a little bit, and CS stands for cranial suspension. So
cranial suspension.
So we essentially resuspend the fat and muscle of the face to the cranial bone of the face. So that's something that doesn't migrate or change with age. So that's why we get a longer lasting result, because we're anchoring the
longer lasting than these other so-called mini lifts or whatever.
Yeah, because now what we're doing, we used to anchor the deeper structures of the face to itself. And
meaning attach.
Exactly. But we would attach it to the deeper muscles. And as we would age, those muscles would migrate down. And even though we had elevated it, as we would continue to age, those structures that we had elevated would start to migrate down. Now what we do is we anchor that to a facial bone that doesn't change with age.
So they last longer.
It lasts longer. And
interesting. Because when I talk to a plastic guy, another guy, okay, and I told him about this interview, because, oh my goodness, Randy, what's going on? These things are so gimmicky. They don't last very long. Well, what is your response? He doesn't get it? He doesn't know what you're doing?
Well, I think that a lot of people have that response because of a lot of these marketing ploys that people have put out there.
And so this is a different lift than what you see on those national ads.
Absolutely.
What are your thoughts on that, by the way? These national ads, we've all seen them. I love the before and afters, by the way.
Well, I think that's the biggest benefit of it. It's really shown us how much of an advancement or change you can have by addressing the jowls and the neckline.
Okay, good.
the max lift does is it addresses all those things, but once again using local anesthesia with sedation, but it's a longer lasting result because we're anchoring it to one of the bones of the face, and we are, not only getting a longer lasting result, but I think a more natural.
Where'd you learn this technique?
I've been to a number of national conferences throughout my training. I trained under 5 different plastic surgeons, and the evolution of the process. This surgery has been around for 10 and 15 years, and we've had good results and not so good results, and we've learned from those not so good results, leading to the evolution of the process or the procedure as it is today. And I go to all our national meetings and we talk about some of the less invasive techniques of facial rejuvenation, because I think everybody wants to look younger to some extent. I think what people don't want are the longer surgery times that come with increased risk, sometimes the overdone appearance of it, and to be honest with you, with this economy, the increased cost of things. And I think by cutting down our operating room time, not only does it give a natural result and a long-lasting result, but it's a safer process that ends up costing less because we're not in the operating room as much. And that has a substantial benefit to patients. I look at it as we get a natural result. Patients look at it as a natural result, but it's also cheaper.
Are you the only guy doing a max lift in the desert that you know of?
I believe so, yeah.
Okay, and so it is for the older patient too?
It is, and
what about the revision patient?
The revision patient actually is the ideal candidate for
Really?
this. Yeah, because what happens is somebody that's had a previous facelift, the skin continues to age. And that is a big issue. And the reason it continues to age and really becomes sagging more is because the underlying structures are putting pressure on that. So we can often utilize the previous incision, maybe modify it a little bit, get down there and actually resuspend the tissues. Now, years ago when we did facelifts, we would remove fat, we would remove muscle to get a tighter appearance to things. Now we understand that we've lost that volume. So what we do is the volume that has repositioned down here, we restore it to a more youthful position.
Natural results.
Natural results. So somebody that's had a previous facelift that doesn't want to go through another extensive procedure, we're able to address a lot of these issues with this max lift and not only get a natural result, but restore some of that volume. We're not removing any volume, we're actually adding volume in a more natural position.
Okay, now what about these eyes that are exhausted, tired eyes?
Well, the nice thing about this procedure, because it takes about 3 hours, we can add secondary procedures, eyelid surgery, facial resurfacing, without extending the operating room time.
You do fat transfer at your location?
I do fat transfer, absolutely. That's one of the things that, as we understand that part of the part of the aging face is loss of volume. So now what we do is not only reposition volume, but we will add volume from another part of the body. That fat comes with stem cells, so not only is it adding volume, but it will actually help produce cells that will help rejuvenate some of the overlying skin. About 50 to 70% of what we inject lasts permanently.
Now you say, and I like this part, you say that you seem to attract people that not want to look different, they want to look great for their age.
Absolutely.
Or they want to look natural.
Absolutely.
You don't get people that want to change their appearance.
I personally
elaborate on that.
My approach to plastic surgery is more of a conservative approach. I think that the role of a plastic surgeon should be to naturally enhance what we already have. Everybody is young, everybody is beautiful. All we're doing is sort of bringing that out. I think where surgeons and patients get into trouble is where they try to create something that was not once there.
Okay.
And when you do that, you're pushing the limits of the natural human anatomy. And sometimes it looks okay, but often it looks overdone or the appearance of surgery. And I think most people, when asked why they don't go through a cosmetic procedure, is the fear of looking as if they've had surgery. Done. Exactly.
We're going to take a quick break. We come back, more about the process and how you determine if this is what's for them, and maybe they need a traditional facelift, or maybe they just need one of the other procedures like lipo or something else. You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We're talking about these minimally invasive facelifts, specifically the max lift, a new way of doing or approaching the aging face. And with us we have the newest plastic surgeon in the desert, probably one of the most handsome surgeons in the desert. He works with Dr. Mo Zachary, plastic surgeon. You guys have the Cosmetic Surgery Institute.
Correct.
Of Palm Desert. So we'll be right back. You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, minimally invasive facial rejuvenation. We're talking about these new I'm calling it a low down time, but it's a minimally invasive facelifts, the Max Lift. With us we have the desert's newest board certified plastic surgeon. He just joined the dream team, they're calling it over there at the Cosmetic Surgery Institute of Palm Desert, Dr. Mo Zachary's office, the newest plastic surgeon. Dr. Habash. Okay, that's a big intro, by the way.
Well, thanks.
And now, a recap for people just tuning in. Well known in the desert for reconstruction. Yeah. You have hospital privileges at both hospitals, correct. The cancer center. You correct. Do a lot of reconstruction. I mean, is that, you still spend about 40% of your time doing that?
35-40% of my time is reconstruction.
Like breast reconstruction mostly?
Breast reconstruction, facial trauma, even hand trauma. It just depends on, what comes through. I get a lot of referrals through the cancer center, so that takes up a majority of my reconstruction.
Now, are you doing those at the hospital, or Absolutely. Some of them you're doing at your center there?
No, I do it at the hospital, usually because it's a joint procedure with a surgical oncologist and, insurance purposes, which is covered by insurance. We do them at the hospital.
Now, tell me this, and this is really off topic here, but doing the max lift, I know in breast surgery, or I don't know, but in breast surgery, you're giving people back what they used to have. But what is the difference as far as gratification for you when you restore somebody's face, giving them back what they used to have? Is it similar?
It's a little bit different. It's a little bit different, but I'll be honest. Both patients are incredibly appreciative,
okay.
But it's just a different approach to things. I think you take somebody that I had a woman that didn't want to go to her high school reunion, her 43 high school reunion, and she was dreading going to it. And she came in. We did a max lift on her. About 4 months prior to her going, she ended up going, had the time of her life, came back, brought me pictures of her high school reunion because she was so happy that she went.
Is that right? That's a good story.
Yeah, and that's something that, obviously she was appreciative of what we were able to achieve. She went out of her way to bring me pictures of this event that she was dreading going to or almost didn't go to. And I think, those are the types of things, are the stories that really you take home. That's why we do what we do. And so you can make a dramatic impact in somebody's life, whether it's a cancer reconstruction patient or a cosmetic patient. I think you can dramatically impact.
In this economy, I had a plastic surgeon actually, or an eye surgeon yesterday here on the show. And he showed me these droopy eyes. And he wasn't just a cosmetic guy. He helps with people with lid problems, but droopy eyes, and then gave him regular eyes. And he said, who would you hire, Randy? Same, everything's the same. Everything's equal. Well, you hire the person that looks more alert, like they have more energy, that kind of a thing. And so in this economy, for people to feel tired, look tired, it can't hurt.
Well, no.
As far as marketing yourself.
Not at all. And I do think that, in some sense, when you look refreshed, you have more energy, and people do more than they may have done before. I mean, they're more energetic, they're more social, they're out there, because they're happier with their appearance. And once again, whether it's a reconstructive patient or a cosmetic patient, when you impact somebody's body self-image to that extent, a lot of people come in, and it's not always the patient as much as it's their significant others that are coming in saying, wow, she is so much more energetic, or she's doing so much more now. And a lot of that has to do with just them being more comfortable or happier with themselves and how they look.
Okay, so this max lift define it again, it's an acronym for?
Minimal access cranial suspension.
And it's not to be confused with some of these national advertised low downtime lifts?
No. I think
because it's a different way, and it lasts longer because why? Help me understand
because
that.
we secure all the elevated tissues to one of the facial bones that does not migrate with age. And so...
I mean drop.
Drop, exactly. And so,
And some of these others do what? They attach it to what?
They attach muscle to muscle. Or really just...
Interesting.
Yeah, and it will give a temporary lift. But then as we age and that muscle becomes relaxed again, it will drop rather quickly. And so what this does is it addresses the same areas, the jowl area, the neck area, but because of our different types, we use a permanent stitch, we fixate it a little bit differently, we get a longer lasting natural result.
You love this lift?
I do, and I think I like it for multiple reasons. It gives you a very natural result. It has a decreased operating room time, so people are really in and out of surgery. They're able to go home really within a week or two, really being back into their normal activities without a lot of downtime. And those aspects of things are really what have limited a lot of people from even desiring a facial rejuvenation procedure. So it just opens up the door to a lot of patients that have always wanted something done but that have been apprehensive.
The patients that you have done the max lift on, do they say things like their family or friends don't even notice it? or that they just say they look better? What'd you do?
Usually, and this is the type of compliments that I want to hear. A lot of times they hear, you look well rested, have you been on vacation, have you changed your hair? They can't quite pinpoint what they've done, but they know something's different. Now the patient, it makes a dramatic difference to the patient. They see the changes like night and day. But people that they interact with have a harder time, but they know that something's off. And for me, that's the ideal compliment. They don't want to
nobody knows your work.
Yeah, they don't want to hear, wow, what have you had done? They want to hear, wow, you look rested, you look great, have you been on vacation?
So if somebody's in their 60s and looks really young, chances are they're your patient.
Well, I mean, I don't know about that, but yeah.
They're whispering. That's Dr. Habash's patient over there.
But, you know, I think, and it's just, you know, surgery is one component of what we do. You know, you need to make sure that you maintain your overall appearance, take care of yourself, and that helps give us a longer lasting result. You know, surgery is one component of that.
You know, I always tell this, and I even tell this to Dr. Mo Zachary, who you work with, that I'm a connoisseur of facelifts. I could spot a good one walking down the street. It's like a good toupee. I could spot those too. But do you think I could spot one of yours?
Probably.
In your opinion?
I'd hope not. I think you're going to notice a youthful, beautiful woman that may look younger than her age, but I don't think you're going to say, wow, she's had surgery.
Do you think this is the new trend, the new hot thing in plastic surgery?
Well,
these lifts?
I think that not only these lifts, but as we understand more about facial aging, it's really opened up a whole new avenue of treatment. We've changed the types of fillers that we use, the lasers are different, our surgical techniques have evolved, and all this stems from an increased knowledge of facial aging. It used to be that you'd sort of throw the baby out with the bathwater. You'd tighten everything, even things that didn't need to be tightened or lifted, because we didn't understand how the face ages. Now, because we understand how the face ages, we really tailor specifically what we're going to treat, and that's what gives us that natural result.
Because the face doesn't age in just one place.
Not at all. And it ages in a very characteristic fashion. You can look at somebody in their 40s, 50s, and 60s and see very characteristic changes of different areas of the face. And that's something that we've really started to embrace and understand over the last 5 and 10 years.
On that consult, by the way, okay, so they come in, maybe people that haven't considered anything before, but they're watching this, okay, because they love my show, right? No, I'm kidding. They go in, what do they ask? I mean, what do they want to know? What are their fears? What are the frequently asked questions?
You know, I tell people that if they're unhappy with the appearance of their face or how they're aging, the easiest thing to do is come in for a free consultation.
What do they ask you every time?
Almost every time they want to know exactly what it's going to entail. What are we going to improve upon? And within that, I usually talk with them and say, well, what is it that bothers you? So we can make sure that we address the areas that bother them.
Okay.
They want to know, you know, how long of a downtime they're going to have. How long are they going to be out of commission? They want to know pain. They want to know swelling. They want to know realistically what type of results they can see. And they want to see other people that have had similar procedures done. And we cover all that within our initial consultation. I like to meet with people not only during the initial consultation, because that's really sort of an educational aspect, not really to determine if you're going to have surgery, but to determine or really gather information to see if it's something that is right for you. Then if people say, this is what I want, I usually have them come back again where we talk even more extensively, specifically about them and the surgery that they're going to have.
Now, do you, and we're almost out of time, do you ask them, or do they bring in their partner? Their spouse on these consults for face?
Some do and some don't. I strongly encourage them to bring them in. I think it not only shows a support group, but often the husband or wife may have some apprehension about the procedure, and they may bring a new light to the line of questioning. I think it also, as we go through the process and they start to understand what the process is, a lot of the apprehension that they may have had initially starts to fall a little bit. And I've had a couple patients that have come in, brought their husbands in. The husband was very apprehensive. And down the road now, I've done a surgery on not only the wife, but the husband.
Really? Well. So the wife will do something?
And then the
husband comes in and gets something done. Now with men, it's obviously a different kind of a lift.
Absolutely.
I mean, you know, my fear would be looking feminine or something like that.
There are certain characteristics of the face that are very unique to a masculine face.
Are men doing this? Have you done a male max lift?
Absolutely. You know, and there's things that we have to understand about that. It is a different procedure because women want high cheekbones, high brow. Men don't want that appearance. Men want a more a straighter jawline. Having a little bit of a boxy jawline is okay with a man. It gives a masculine appearance to things. So they don't want a feminized appearance to the face. And so there are certain techniques that we will modify specifically.
How much is art, by the way? I ask everybody this.
How much is
art and how much is science? I mean, you have to have an eye for it. Because I know some plastic surgeons, I meet them and they got the big lips, the high brows. And I tell people, because they always want a referral, and I don't refer people. I say, go, look at their work.
Well, there's a significant amount of science that goes behind it as far as measurements and standardized measurements of the face and distance between the ear and the corner of the mouth and those types of things. So those are things that we do preoperatively. The actual surgical technique is really where the art aspects of the surgery comes into play, and understanding how the face is going to move not only in a two-dimensional but three-dimensional plane, what we're trying to restore, and understanding those things. That's really where the artistic aspect.
Would you put your facelifts against anyone's? I mean, do you think you're at the, maybe not at the top of the game, but I mean, do you think that your results are as good as anybody's?
I think I get an incredibly natural result, long-lasting results. And
is that what you want people to know about you?
Yeah, and I think my best judge of my results is really my patient satisfaction. And my patients are happy, that makes me happy, and I think that determines a good result.
If they go to your office, can they look at some before and after photos?
Absolutely, absolutely.
Okay, good.
Absolutely.
You have permission, I hope, of this?
Of course, yeah.
These people, that's good. Final message. Somebody watching this, they don't like the way they're aging, okay? They've heard about, minimally invasive facial rejuvenation, maybe about the max lift. Final message to them.
I think that the easiest thing to do is just come in for a consultation. We cover so many things in a 45-minute or 1 hour consultation. Some of it may apply to them, some may not. But they gather that information, and then they're able to determine if this is something for them and something for them at this point. I think that there's a lot of benefits to what we do. And our techniques have evolved so much that a lot of what they've seen in the past doesn't really apply now. And the only way to really understand that is to come in and talk.
All right, great. I want to thank you for coming in.
Well, thanks for having me.
Good job.
Really
Dr. Mo Zachary did a good pick when he you guys aren't old buddies, right?
No, we met after I moved to the desert, but we have a lot of similarities and we get along really well.
All right, great. Thanks again for coming on. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. And by the way, if you'd like to see the uncut version, the long version, the marathon version of this interview, you can go to our website at wellnesshour.com, where we have it there. And if you'd like a direct or see this again, if you missed the whole 28-minute interview, you could go to our website, put in Dr. Habash, and you can see the interview there. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.